Hi, my name's Danny. I'm a nuclear medicine student. I'm here at Tucson Medical Center, and right now I'm going to show you a hot lab. So if you look to my left here, this is the door to the hot lab. You see a big caution sign of radioactive materials, because we'll be handling radioactive materials in that lab. And it is a locked room, and we have these special badges to have access to them. Okay? So come on in. When we first come in, over here we see a microwave, and we use this to prepare meals for the gastric emptying studies, because we actually cook eggs that contain radioactivity, so we don't want that anywhere else besides the designated hot lab. Over here we have a sharps container of needles that don't have radioactivity, the cold needles. And here you see a lead box, and that's because we contain our needles that are hot, that have the radio active materials, and that's in here. So the shielding just helps protect everyone from the radiation. And then here is where we can, these are lead blocks, and we can do wipe tests here as well. And here's just gloves. We always want to make sure we're wearing gloves to be safe. This right here is what we call an L block. It's shielded and has this window, so we can prepare doses like so and protect ourselves with this shielding here. And then right here is our dose calibrator. This is what we use to measure the radioactivity of all the doses that we give to our patients, because we want to make sure it's very accurate for their safety and so that the study can be performed well. Here's another L block. Here's tongs, so that when we're handling radioactive materials, we can use a safer distance, which will also help with exposure. And right here, this is actually called a xenon gun, and it's an instrument we use to administer radioactive xenon gas for when we're doing lung imaging. And then right here are syringe shields, so they're the lead shields that will put the dose in to also protect us and our patients while we're administering the doses. And if you come over here, we have this lead cylinder here, and this is our cesium source, which we use for quality control. And over here we have two survey meters. This is called a pancake probe survey meter. We use this to detect contamination. And this one we use to detect exposure. So I'll do a little quick demonstration of what this sounds like and looks like. So if we just turn it on, you'll see the needle moving, and you'll hear the sound based on how quickly the needle moves. And so this right here is actually shielded, and it has materials that were decaying. So you can see the metal here. And so if I just put this right here, you can see the needle moving, and it's detecting radiation from that.
What happens if you open it up? How does that change how much detection is going on?
So if you open it up, it'll be a lot more. So I'll show you. So with the shield, you can see has a relative amount. And if we were to open it,
Maybe on the other side.
it's actually about the same. I decayed. So it's actually about the same because it has decayed. But we'll take a look at this over here. So it's shielded. You can hear it's much quicker, much hotter. And if we were open it, hear how loud it is? So that's very hot. So if you hear that, you know that there's contamination.
Or at least radioactive isotopes that are present.
Yeah, radioisotopes. And then here's our computer. Right here we use to check in doses or receiving. And we do a lot of different things for the hot lab here. We can click on patient management. And this is where we can drop doses and print out labels for them. And it also tells us all the tasks we need to perform, quality control, and various things. And right here is a sheet source that we use for some quality control and also for some scans. And it's shielded in here. And it just looks like this. So inside this sheet is cobalt-57, which is a radioisotope. And we keep that shielded and protected. Keep it back here. And here's the refrigerator. Some medications and some radiopharmaceuticals needs to be refrigerated, so we keep them in here. Over here. And that's the license for the radioactive materials lab. Here's a list of some procedures and the radiopharmaceuticals and the doses that we need to use. And then over here, we have a sign that says incoming. This is where we have our incoming packages of doses. This is where they are, so we know to check them in. And at the end of the day, when we're going to return them, we have a designated area called that says outgoing. So that's right here. And this trash is hot trash, so trash that could contain radioactivity. And these we call tackle boxes. They're just shielded boxes where we can put the doses in when we're transporting them to our patients. And that's a quick review of our hot lab.